Hello everyone, and welcome to Tubes and Drains. Let's talk a little bit about some tubes and drains. So in your chapter reading, we're going to just highlight on some of these tubes and drains. I passed them around in a class. I passed around an NG tube. We can put NG tubes to suction, drainage. We have something called a Salem sump. We have wound drainages. We have hemovacs. We have Jackson Pratts. So we need to identify options for toileting and devices to be used. Describe proper maintenance of urinary catheters. Describe measures to promote bowel elimination. So in your book, I found a lovely picture of an NG tube. I like this because it talks about suction and it shows you the picture of an NG tube and it gives you this nice paragraph about it. A lot of people always get the purpose. So nasogastric tube is used for nasogastric decompression. Please do not forget that. So it does have different things attached to it, but the most important thing is decompressing the stomach. Now here we have a Jackson Pratt, a Hemovac. We also have wound drainage, and then wound vac is a negative pressure. So it depends on the facility. You'll see different things. And as we're in the clinical environment, I will show you. I'll look in the skills lab and see if we have the Jackson Pratt so I can show you, and the Hemovac. If not, more than likely you will see it in the clinical environment. I have one more. So let's talk about promoting nutrition and hydration. So when patients have these things, we need to make sure we promote nutrition and hydration. So by mouth meals, meaning meal setup, helping them like that. We got to make sure we include their cultural and religious preferences, like their food needs, making sure that we're including that cultural diversity in there. What about internal hydration? Types of devices. Even though the NG tube is put in, it can be used for suction and can also be used for feeding. And then we also have tubes that come out the belly, or not necessarily belly, out of the stomach, where it's put in surgically, and we can feed the patients through the PEG tube, or some say G tube. Okay, and we also have the maintenance of the tube. We got to make sure we clean around the site. Making sure that the tube remains patent. And then, of course, with hydration and nutrition, IV hydration, we maintain in that site, making sure no signs and symptoms of infiltration, and we're making sure that the IV fluids are going, and we're monitoring their electrolytes, and we're assessing. Here is more tubes of what I was speaking of. Here we have another type of NG tube that goes down, placed by radiology, in the radiology department only, and we will all teach you how to put an NG tube down, and which will go directly to the stomach. We'll show you that, and also there's some videos in ATI for that also. This is your gastrostomy tube, short for G tube, and it's placed surgically by a doctor. It's kind of similar to like that Foley catheter I was showing you. There's a balloon that deflates inside, so the tube does not come out. Okay, and when we put these, the NG tube in, we make sure we measure from the tip of the nose to the earlobe to the xiphoid process. Tip of the nose to the earlobe to the xiphoid process, and you always have a second RN check for your placement. We'll talk about this more in detail in 214, but I do want to hit on it a little bit now. Stages of sleep. So know your stages, and I have them right here. You have stage 1, 2, and 3. You have non-REM sleep, a rapid eye movement. That's eyes closed, but you can easily be awakened. So look at your stage 2 is light sleep, and stage 3 is your deep sleep, harder to arouse. Now REM sleep usually happens 90 minutes after you sleep. As you know, as being a student, there are so many different factors affecting our sleep. You can, stress of trying to study for exams that are coming up, medications, lifestyle, emotional stress, just the environment. When patients are in a different environment, i.e. the hospital, definitely will have a hard time sleeping because it's not their comfort zone. They're in a different bed. There's these strange people like us coming in with all these smiles, different types of food, just different. So these are all factors that affect the sleep pattern. So look at the sleep assessment slide. So these are things that we should be talking to our patients about. So include this in your assessment. Even though I may not have it, I think I do have it on the back of your assessment form when you go to clinical, but make sure that you include sleep. Sleep is very important. We heal when we sleep. Now I have another slide, feeling the effects of sleep deprivation. Look at each one and see how much sleep is important to us. Okay, so if we don't get our sleep, we can start feeling, if we don't get all of our sleep, we will start feeling the effects of not having enough sleep, sleep deprivation. Now, as we move forward, we're going to talk about comfort and pain. So factors influencing pain. Of course, age, fatigue, your genes. What about spiritual factors? Coping style, anxiety. These are all factors that influence pain. But pain assessment, you have types of pain. So remember, know the difference. You have acute pain. Now so you'll hear people say, oh, this patient is in chronic pain. Know what they mean when they're saying chronic pain, longer than 6 months. What about cancer pain? It's caused by tumor progression, toxicities of treatment, infection, invasive procedures, and infection. I'm not sure if I said infection twice. I think I did. I have it here twice, so I apologize. But we have also chronic pain, and then you have acute pain, less than 6 months, something that happened, short duration. So it's unrelieved, acute pain, and then sometimes it goes into chronic pain. Look at this chart. I mean, if you need to make the slide bigger, you can, but the different organs and where your pain will be. So it's really important to know where your pain will be. And you can try when you do your assessment if patients are complaining about certain areas, and then you can say, oh, this might be the heart. They're talking about their chest and their arm. Or if they're talking about the neck and on the diaphragm area, it could be talking about the lungs if they're having pain over here. If they're having pain in their right upper quadrant, right underneath the chest, it might be pain in their liver or gallbladder area. So look at nociceptive pain and neuropathic pain. Please follow the ABCDs of pain assessment. Ask about the pain. Please believe the patient. Document what they say. Choose pain control options. Deliver interventions in a timely, logical, and coordinated manner. And make sure you empower the patient. Give them control. Now I have this on your assessment form also, so you have it here also. So we're trying our best to load you up with all this knowledge so you'll know about the characteristics of pain and how to assess for it. And this is your PQRST. So look at all of what each letter is for. Let me know if you don't understand because it's expected in your documentation after each clinical day. Here you see various different pain scale and for documentation. Now I have here some pharmacological interventions, analgesics, non-opioids, Tylenol. You have to be careful with them because they can cause, see the red highlighted, they can cause certain problems. So we have to make sure that we're careful with the medication and that we do our assessment really good. Certain medications cause respiratory depression. So we want to make sure that we monitor when patients are on pain medications, especially narcotics, that we're monitoring their respiratory status, taking their respiratory rate for a full minute. So these are very important critical thinking from the nurse. And then, of course, we have non-pharmacological interventions. And look at these. Relaxation, maybe turn the lights off, give them something warm to drink. Sometimes we have pet therapy in the hospitals, different things, a nice back massage, which will be required of all of you starting, I believe, your next clinical day. All patients will receive back rubs. Let's talk about nutrition and hydration. We kind of talked about that a little bit with the impaction, but these are factors affecting nutrition, and it's just another repeat to let you know how important this information is. I won't spend a lot of time on it, with your nursing assessment. We're going to make sure we do a screening tool. Get the nutritionist involved too, okay? Talk about, how they're eating, their eating patterns, what they like to eat. All of that is very important when you're doing a nutritional assessment. Calories, but we don't really do the detailed assessment. The nutritionist does, or the dietitian does. Okay, but we do want to make sure that as a nurse, we want to know what labs that we will look for. So remember how I talked about labs with the hypoxia and the kidneys and so forth. And so for nutrition, we want to make sure we look at the prealbumin, albumin, and even your hemoglobin. Okay, we want to look at your transferrin, that's your iron, total body iron capacity. That lets us know if these patients are getting enough nutrients in their diet. Urinary urea nitrogen, urinary creatinine, protein catabolism, all of that is very important. Trust me, I just went through this recently, and you need to make sure you know your prealbumin. Look it up and know your levels too. So this slide is also talking about oral nutrition, hand washing, oral care, feeding. We did a lot of that in the ATI module, so I'm not going to spend a tremendous amount of time on this. And feeding patients, also in your ATI modules. So internal nutrition, this is how we feed patients through the different tubes, through the NG tube or the gastric tube. So sometimes they need additional different type of nutrition to help them so they can heal. Remember, we need protein for healing. Okay, we have the G tubes and the J tubes. It just depends on where the doctor put the tube in and for the reason why. So make sure we assess for bowel sounds and an abdomen, check the skin around the tube. I said that earlier, looking for allergies. All of these are very important. Check tube placement. We'll show you how to do that in a clinical setting. All of these things are very important that we have to include in our assessment. So as a nurse, we have a very big job. This just shows you what the machine looks like. They have more higher tech machines. This is for the patient that will deliver not medication. Oh, well, you can deliver medication, but this particular device is to deliver the feeding through the tube here to the patient, or the patient can have it to gravity, where they will pour it in and hold it, and it go in very slowly. Each one of these is either you can pour it in a bag that's attached to here, or you can pour it in the syringe, and they come in different calories. 1.5 is what we see here, but it depends on the dietitian and what he or she wants the patient, how much calories she wants the patient to have. Okay, so that was our tubes and drains and nutrition. And next we will go over fluids and electrolytes on the next slide, because there's no way we got enough time to include it in here. But our next slide will include, our next presentation will include fluids and electrolytes. Thank you for listening. And once again, this is under 15 minutes.